Hello, I am Cecilia Faini, a faculty in the Department of Veterinary Science from a university in Argentina. I am here to present the collaboration we conducted with computer science and public health colleagues from the United States, Argentina, and the Netherlands, entitled A Canine Census to Influence Public Policy. We present the results of Cecilia's first ever domestic canine census. Doing so involved an interdisciplinary group. The main objective of this work are providing an exhaustive description of Cecilia's domestic dog population and identifying new problems that emerge from the surveyed dog population which can be addressed by new public policies, thus responding to the demand of the region and its inhabitants. We collected census data and conducted systematic probabilistic sampling by three areas, differential by social, environmental, and economic aspects that characterize Cecilia. The surveyed areas include 60 blocks, results in 418 voluntary responses. Based on collected responses, we analyzed the data of 841 dogs uniformly distributed across gender. Finding an implication. Close to 40% of domestic canines have been sterilized, for the most part female. Majority of the sterilization occurred on adult specimens aged 1 to 7. The high proportion of an sterilized male impact in their social behavior entails wandering and territoriality, which often result in dog fights, bite of people, the transmission of disease, and traffic accidents. Not only must the system ensure the economic and geographical accessibility to an operating room, but it must also include educational strategies that raise awareness of negative consequences of non-sterilization. We find that deworming, internal or external, and vaccination for rabies are not conditioned by the number of dogs in the household. There is a statistically significant correlation between vaccination for leptospirosis and number of dogs per household, where more dogs implies a higher likelihood of overlooking this type of vaccination. In Argentina, there is a law that establishes the vaccine as mandatory. The city-sponsored revaccination campaign, together with application of deworming. On the other hand, the leptospirosis vaccine is not part of the sponsored campaign. Therefore, state policy responding to this concern should include targeted campaign of high-risk areas. Census data reveals the correlation between geographical areas and number of dogs per household. We see that the highest percentage of sterilization dogs come from households in area 3, whereas most sterilization dogs come from households in areas 1. We see that the reason that yields the highest correlation for households in the least effluent area, area 3, is lack of time, followed by I will do so in the field. On the other spectrum, households in more effluent areas, areas 1 and areas 2, justify no sterilization their dogs since they live inside and would like to breed in the future respectively. The results above evidence that the fact that a low-income region should be the focus of attention for public policy related to responsible pet ownership. In this region, it is imperative to ensure economic and geographical assistance by performing state-sponsored sterilization in peripheral neighborhoods. In contrast, we suggest that education and awareness campaign would be more effective in areas 1 and 2. Canines with frequent access to public roads pose a risk to human health. Only 50% of these dogs are vaccinated for rabies, a low percentage when considering that this vaccination is mandatory. The percentage decreased even further for leptospirosis, 30%. Compared to vaccination, the percentage of frequently deworming dogs with access to public road is much higher, 75%. The high proportion of dogs with access to public road is a threat to public health. Leptospirosis is an endemic zoonotic disease in Cecilia, whose action by the state to address the low vaccination coverage are a must. Previous related concerns are much more worrisome, given that in addition to being a lethal zoonosis, there is evidence of the circulation of this virus in Cecilia. Vaccination rate should reach 100%. On the upside, the high proportion of the deworming dog is positive for health care, as it prevents disease spread to other dogs and humans, which can be done via contaminated dog feces or ticks, to name a few. Results show that 60% of females with access to public roads are sterilized. The percentage that drastically decreased among males, 14%. That is why sterilization mechanisms should be intensified, with a greater emphasis on male and social sector with economic difficult, low-income areas. These actions should be supplemented with an educational policy that emphasizes the importance of long-term behavior change regarding responsible pet ownership, specifically the adoption of new habits that foster health care for dogs and their environment. Conclusions. We were able to recognize potential risks organization from the population under study, mainly the transmission of zoonosis and uncontrolled breeding. At the same time, we identify geographical areas and social stratum that should be of primary concern to the City Council when it comes to implementing immediately action regarding sterilization, improvement of sanitary conditions, and education related to responsible pet ownership. This study serves as a preliminary evidence on the importance of generating information on canine demography and its link with human and the environment at the national level. Thank you very much.